Hey Kickstarters, I'm Ben, and this week's topic is topic 16, and it's sort of, as Jack mentioned in his video, it's kind of part of this whole health series that we're doing once monthly videos for. So this week we're looking at emotional and mental health. I think that's really, really important, not just for trans guys, obviously, it's really important for everybody. But I think that we have such a difficult time going through the medical system and really just trying to sort of handle the entire process that a lot of us become um, almost afraid to turn to the medical system for help. Mental, emotional, like it's totally justified though. I think there's some pretty awful experiences, and some healthcare providers, knowingly or unknowingly, can aggravate whatever it is that you're dealing with. That said, I was fortunate enough um, to be given a spot in the counseling program at Sherborne. So when when my life basically was blowing up last year because I was outed to a lot of people across campus, and I was in a really, really bad place because of it, and it was my employer who did that, but that's a whole other story. What was fantastic is that I had this relationship with this counselor there. Uh, we had known each other um, prior to this event, and I wish we sort of had, because then he would have had more to go on to sort of adequately assess like just um, how much I had changed because of what was going on. But seriously, having him there to talk to and to sort of help put things in perspective for me was amazing to have and really important. And I don't think, I was in a very bad place. I was actually admitted to the hospital at one point because I just didn't really feel safe anymore to be left on my own. So having him there to, he definitely really helped me get through all of that. And it's still something that I'm going through, but for the most part, it's done now. And at this point, I'm starting to be able to move on with the help with the help of Zoloft, which he helped me get on because his assessment and then just discussions with my family doctor at Sherborne were able basically enabled her to say, okay, I think it's reasonable for me to start you on this medication. Um, what you don't want to happen, the reason you should always have somebody to talk to, whether or not they're actually certified, is that you want somebody who knows your story, who's familiar with you. That is invaluable. If you end up somewhere like the hospital, it is the most tedious thing because they make you relive everything multiple times. Because first you have to do your intake, you have to explain it there. Then you will meet with a nurse and you have to explain to the nurse. Then the nurse brings in a doctor. Then you have to explain to the doctor. Then you have to explain to a psychologist. The psychologist does an assessment. Then you're going to have to go back and meet with psychiatrists who you have to re-explain it to. It's just, it's really awful. It's really, the system is not good. I'm not sure if anybody else has had experiences in hospitals perhaps that were better, but that was mine in Toronto at a fairly progressive hospital, very well-known hospital. So, that's why it's really nice to have somebody who already knows what's going on in your life, or who, who has your history, so that they can, you don't have to keep doing that, and they can actually adequately assess it in terms of professionals anyway. Um, this all said, there's been some talk about whether or not um, we should have to go to therapy and be assessed for transition. I'm not really sure how I feel about it in general. I think there definitely should be some. I don't think it should be as crazy intense as as it is, and generally putting the therapists in a bad position of acting like gatekeepers, because that's a lot of what the system supports at the moment, and then putting the assessees in the position of, in a lot of cases, trying to figure out what the assessors want to hear, so that they can begin the process of transition. I mean, really right now what's happening is the length of these assessments are impeding individuals' steps towards being more comfortable, being happier, being more confident with themselves. So it has its pros and its cons. Obviously, we don't want people running off and doing things that are going to, that they might regret, but in that same vein, people get tattoos. And you don't need a doctor's assessment in order to do that. And those are more permanent than the effects of testosterone or estrogen. So, it's kind of, there are a lot of things wrong with our medical system. There really are. But I think that there should be some way. We do sign informed consent forms at the end of our assessment period, so I don't know why we couldn't just do that. Like you meet a couple times with a social worker, and then you meet with a psychologist, and then you're good to go. And you just sign that form, rather than these multiple meetings and assessments and tests and all that stuff. So I really think that it's much easier to assess if there's something else going on with an individual. I also am really frustrated by the fact that we have to be more mentally stable than everybody else in society, basically. Well, not everybody else, but probably a lot more mentally stable than a lot of people. Where was I going with this? Uh-oh. I'm a mentally stable psychologist. Oh yeah, because a lot of us suffer from mental health issues such as depression or anxiety that aren't actually what are causing gender identity disorder. We're not even going to get into terminology, but are a result of. But if you look at the assessment process, they're really treating it as the cause and not the symptom that it is. So it's very, my thoughts are just convoluted now, because you can just look at this from so many different perspectives. But ultimately, what I'm trying to say here is, yes, there are issues with the medical system. Yes, it sucks. Yes, I don't particularly like doctors. You probably don't either. But it really is invaluable to have some kind of healthcare professional who knows you, who's monitoring you, whether you check in with them once a week or once every couple of months. It's just very important that you have that support in place in case, heaven forbid, anything does go wrong. So yeah, that's it for me this week. I tried to upload my top surgery video, and I don't think it uploaded properly. I'll maybe try and do a re-upload, but I apologize if it doesn't end up working out. I do have a MacBook in the mail so that I can make proper videos that upload correctly for you guys. So anyway, that's it for me, so I will see you next week.